Thank you and good morning. I'm here today because I've made a choice. I've chosen the people of Arkansas and their health care and their well-being. And this morning, my House colleagues and I introduced a bill, and you're going to remember this number, House Bill 1204. We choose to create a trauma system that's going to save lives in this state. We choose to provide support for community health centers and area health education centers and in-home care for senior citizens. We choose to support these important programs through our state Medicaid program. We choose to do all of these things because we have real people in this state that are dependent on us, and we're not going to let them down. But it's going to take every single person in this room and a bunch that are outside of this room to get this done. So I'm here to ask for your help. I'm here to ask for you to be for House Bill 1204, and working together, we're going to get this done.
From my tenure in the House, throughout my tenure in the Senate, as a person who's never supported a tobacco tax, and I am full bore for it this session. Let me close by saying this. A trauma system is an awful lot like a police officer. You don't appreciate it until you need it. So I would impress upon you, in hopes that you and your family never need it. But should you, for goodness sakes, let's have it in place.
Our trauma system must be a statewide system. It is a statewide problem. All Arkansans need a trauma system, and they need it now. We cannot wait 2 more years until the next legislative session will mean hundreds more preventable deaths, hundreds more preventable disabilities. We need a trauma system. And friends, the time is now. I urge your support of this legislation.
Currently, there's 120,000 Arkansans that get their medical care and their dental care, substance abuse treatment, mental health treatment through community health centers. That number could easily double if we had the facilities and the providers to be able to do that. Our system right now, quite frankly, is crumbling. We've had to close 3 community health centers because of lack of resources. We have 2 or 3 others that are on the verge of closing. We've had to cut back staff in some cases. A pack-a-day smoker in a week will generate an additional $8 of expenses to himself. You know, about 4 or 5 months ago, that bought you 2 gallons of gas. Governor, to me, that's a small investment to make in the health of our people. I'm glad you're doing it. You folks, you're doing the right thing. Thank you.
Ladies and gentlemen, we need all that we can get from our community health centers. I hope and pray that those that are able to make the decisions about this will truly consider all of us, those of us that live in small rural areas that don't have affordable health care. And if it was not for these centers, we don't know what we would do. Please be favorable to us. We need our centers.
It helps every community, and it helps every aspect of our whole healthcare delivery system. It helps poor people disproportionately more. It helps rural disproportionately more. It helps trauma disproportionately more. It is a comprehensive package, not one isolated package. We have seized, if you will, an opportunity. We have seized a chance to do something comprehensive about health care. We've seized a chance to say this isn't just about one city, one community, or one aspect of where we need to go in improving the quality of lives and the quality of health care for our people. This helps you whether you're in Bentonville or Mitchellville. This helps you whether you are in Fouke or whether you're in Amarillo. It makes no difference whether you're in the northeast or the southwest corner or the southeast or the northwest corner or anywhere in between. Can you understand how important it is if we can treat people where they live, if we can provide services for them where they are? It's better for them. And you know what? It's better for the taxpayers because it's cheaper. This is a once-in-a-generation opportunity for Arkansas to step forward and leapfrog other states that we like to think we compete with. And now you've got the leadership of the House and the Senate. You've got so many people in the medical community working with you. You've got this network of community providers that are adept at being able to communicate their message to their folks back home. And what it's going to take now is all the rest of us talking to our friends and neighbors and ensuring that the proper message, the truth, gets out. And tomorrow, maybe, we'll have a healthier Arkansas. Thank you.